COVID-19 is also fanning the flames of gender inequality. The World Bank says internationally, of all businesses forced to close from COVID, 34% were solely owned by women, as opposed to 25% owned by men. 30.9% of American women are unemployed, as opposed to 21.5% of men. Add to that an increased burden of child and elder care that's falling disproportionately on women, and the picture is bleak. The Center for Global Development has launched an initiative to fill in data gaps about the pandemic's gendered effects. And Megan O'Donnell is the assistant director of that program. Thank you so much for being with us, Megan. Is COVID-19 harder on women because the economy was already harder on women?
I think that's fair, Lindsay. I mean, obviously, we've seen that in terms of the direct effects of the disease, men are more likely to be contracting and dying of COVID. But COVID has really magnified or exacerbated pre-existing gender inequalities. Whether we look at gender-based violence, which the UN Secretary General back in July acknowledged as a shadow pandemic, or whether we look at women's businesses, as you mentioned, being more likely to close, or women losing jobs. We see that this has truly been a gendered crisis. And in terms of social and economic impacts, women are being hit harder.
Why are women losing their jobs more often than men?
So it's two reasons. First, we have to think about where women are located within the economy. Women are more likely to be in retail, tourism, other services, where containment and lockdown measures have hit hardest. And the second, as you mentioned, is childcare and domestic responsibilities that women disproportionately perform. So as schools remain closed, as childcare centers have closed down, it's women who are leaving the workforce to supervise and care for children.
Let's pick up on something you said as well, the shadow pandemic. Brigham and Women's Hospital in Boston conducted a pretty eye-opening study on domestic violence. And in that study, researchers looked at apparent and reported cases of abuse during the shutdown. And combined, they found 55 cases of suspected abuse severe enough to seek medical treatment. To put that in perspective, the hospital treated 15 cases, so 15 there versus 55 in all of 2017. These are only the cases, by the way, that sought medical help. It's not just here in the U.S. It's a problem all over the world. In fact, here's what a spokeswoman for the UK's domestic violence group Refuge told us.
Monday to Friday of last week, we have seen an increase on average of 25% of calls to Refuge's National Domestic Abuse Helpline. Domestic abuse is the biggest issue affecting women and children in this country. Almost 1 in 3 women experiences domestic abuse in her lifetime, and 2 women are killed every week.
What would you like our viewers to know about this issue?
I think the first thing to note is that this is not a COVID-specific problem. Exactly as you just showed, 1 in 3 women pre-COVID were likely to experience violence. But COVID has magnified the risk. So under containment measures, victims have been in close quarters with perpetrators of violence. They've had trouble seeking help, leaving to seek medical care or legal counseling. And it's critical that policymakers like here in the U.S., but also globally, acknowledge this shadow pandemic of gender-based violence if we are to truly have an inclusive recovery.
All right, Megan O'Donnell, thank you so much for joining us today.